Our planet is subject to the rhythm of change. We experience extreme fluctuations in temperatures, rising sea levels, and an increase in natural disasters and associated migration. Climate-related disruptions are impacting the essentials of a good life: clean air, clean water, food security, and shelter. This goes beyond any specific group of people, as factors like gender, age, race, economics, education, and social status all intersect to determine vulnerability and resilience in the face of climate change. Join us as we explore the stories of 3 individuals from different parts of the world. Meet Chioma, a Nigerian woman living with HIV, Dimitri, a 15-year-old teenager from Albania, and Nyasha, a pregnant woman living in rural Zimbabwe. A seemingly unlikely connection ties their experiences together: the intersection of climate change and their sexual and reproductive health and rights. How are they connected, and what challenges did they face? You'll discover it all as we dive right in. Welcome to Empowering Change, navigating the intersection of climate and reproductive health and rights.
As global temperatures rise, so does the urgency to address the interconnection between climate change and sexual and reproductive health and rights. And climate change is more than just extreme weather event causing destructions. It goes deep into our personal lives and is a major threat to public health in this 21st century. The interconnection between climate change and sexual and reproductive health and rights encompasses various concerns, including negative impacts to maternal and newborn health, causing complications such as gestational diabetes, low birth weight, and premature births. It amplifies gender-based violence, exacerbating challenges such as intimate partner violence, forced marriages, and female genital mutilations. The displacement and food insecurity caused by the climate change also aggravates human trafficking and sex exploitation. These climate-induced disasters such as floods, cyclones, and drought also strain the healthcare system, disrupting flow of medical supplies and access to healthcare. And this has got adverse impact on health, especially among women, children, and key populations in vulnerable situations.
Let's delve into a story that exemplifies this a bit more. This is Chioma, a 35-year-old woman from Nigeria who was diagnosed with HIV 5 years ago. She was taking medication regularly and her viral load was under control. However, everything changed when the floods hit. Most of the medical facilities were shattered and the supply chains were broken down. Chioma couldn't access her HIV services and treatment anymore. She knows that without her medication, the virus will start multiplying in her body, with the risk of infecting others and her eventually getting sick.
The damages caused by these cyclones and floods to the healthcare facilities and road infrastructure not only disrupt the flow of medical supplies, but also hinders the movement of healthcare personnel and mobile clinics. A study found that since 2011, about 11 million women experience disruption in accessing contraceptives due to displacement resulting from climate change. The disaster risk management policies and programs often fail to address these SRHR challenges. And this leads to diminishing attention and lack of funding for sexual and reproductive health services during emergencies. And this neglect also hampers mitigation measures and long-term recovery process. In Bangladesh, for instance, a study among rural women in coastal communities found that there were no sexual and reproductive health services for women in cyclone shelters. Sanitary pads and contraceptives were not included in the disaster relief packages. And there were no healthcare services for women with gynecological and pregnancy complications.
However, disruption of healthcare facilities is not the only climate-related impact on sexual and reproductive health and rights. Dimitri hails from Albania, born into a family of humble farmers. His life took a dramatic turn when he became a climate refugee, compelled to leave his homeland due to prolonged droughts that devastated his farmland and left him without a means of sustenance. Seeking refuge in Germany, he hoped for respite, but instead he found himself trapped in a harsh reality, becoming a victim of gender-based violence. In this foreign land, Dimitri struggled to provide for his family, facing the grim challenges of violence and displacement. The weight of adversity bore down on him heavily, a testament to his resilience against the unrelenting forces of climate change and cruelty in his new, unfamiliar environment.
The impact of natural disasters often goes beyond what we might see on the surface. Natural disasters can exacerbate public health problems that are already highly prevalent as gender-based violence or GBV. GBV can be expressed in physical, psychological, sexual and domestic forms and is committed against persons because of their gender. The perpetrators are mostly people they know. Yet in the case of disaster-related GBV, it is also committed by people whom one has become dependent upon. We then often see forms of forced sexual intercourse in exchange for protection, food, housing, in short for survival. Research has uncovered 3 key factors at the crossroads of extreme weather events and GBV. First of all, when a natural disaster strikes a region, it creates challenges for everyone affected. People might face losses of loved ones, housing, crops, livestock, their jobs and income, which all lead to heightened levels of extreme stress. It has been well evidenced that this increases the risk of GBV. Second, during crises related to natural disasters, traditional notions of gender roles are reinforced, which fuels gender inequalities. Moreover, victims consider the disaster and rebuilding of society as the goal one should go for and not the personal problems one might encounter. In Ethiopia, for example, we noted an increase of 119% of child marriages across regions worst hit by the drought in 2022. At the same time, female genital mutilation increased by 27% as well to make sure that the girls would be considered a good marriageable party. Third, when extreme events strike, known structures of stability and control might fall away. Hence, we see that as law enforcement is not functioning as before, perpetrators have less chance to be stopped or arrested. At the same time, victims have less access to healthcare, while evidence has proven that providing holistic care, meaning medical, psychosocial and forensic care, is essential to recover well from the GBV.
Nyasha is a 30-year-old pregnant woman living in rural Zimbabwe. This summer has been particularly hot and very dry. At 26 weeks gestation, Nyasha noticed some pressure in her lower belly, but thought it was the baby's position. A few days later, she started having cramps and episodes of diarrhea. Nyasha and her partner got very scared, so they went to the healthcare center in the nearest town. A day later, she went into labor. Their tiny baby was born at 27 weeks and weighed just 1.1 kilograms, which is extremely preterm. Both mother and newborn were hospitalized, and the baby received the extra help he needed to survive. It will be a while before mother and baby can go home, and being inside the hospital is suffocating because of the heat. Nyasha fears for her baby's life and is especially worried about the care plan the baby will need and whether he will be able to grow and develop normally.
Climate change impacts all human lives. It disproportionately affects populations in vulnerable situations, including pregnant women and newborns. Evidence shows the devastating impacts of climate hazards on MNCH. Among this evidence, things like extreme heat that we have particularly researched stands out as an emerging and urgent threat. We know heat exposure is linked to a range of adverse maternal and newborn health outcomes. And these include hypertensive disorders in pregnancy, gestational diabetes, preterm birth, stillbirth, but also after delivery. Things like reduced breastfeeding and also disruption to health service access. Some of these associations are very clear, and we know, as per the WHO UNICEF report, Born Too Soon, which highlights that exposure to extreme heat leads to a 16% increase in the risk of preterm birth. Other health outcomes, such as congenital defects, gestational diabetes, eclampsia, are aspects that are much less well researched, and further work is still needed in that field. Over a third of the world's children, around 820 million children, face exposure to heat waves. Yet information on thermoregulation in newborns and children is still very scarce. We know this population group carries a heavier burden of climate-related health impacts compared to adults, especially due to their physiological and cognitive development. So importantly, heat exposure and heat stress aren't confined solely to countries in Asia and Africa. It's really a global concern. And although low and middle income countries have less adaptive capacity, this is a universal issue that needs collective action across diverse regions.
Drawing from this overview, we propose a series of robust policy recommendations for taking decisive action at the intersection of climate change and sexual and reproductive health and rights. Develop and implement disaster risk management policies that explicitly address sexual and reproductive health services. Invest in climate-resilient SRHR facilities that can serve as lifelines during crises, safeguarding the well-being of communities. Launch robust awareness campaigns to educate communities about the risks posed by climate change to sexual and reproductive health. promote gender equality policies and programs, and empower women and girls economically, socially, and educationally to make them more resilient for climate-related challenges. Develop and implement heat plans, including providing cool shelters, heat-related health information provision, and ensuring access to safe water. Support research initiatives to further examine the direct and indirect impact of climate on SRHR. Provide gender-based violence-sensitive training for healthcare professionals and emergency responders. Develop new or strengthen existing laws and policies related to gender-based violence with a specific focus on addressing issues exacerbated by natural disasters.